I rise to talk about some of the matters we're working on today with regard to votes that will take place later today. We now are in a period in our economic history where we've had a significant recovery, but we still have a ways to go and still have families across the country that are living with some economic uncertainty. We can take steps today and certainly in the next couple of days, and we hope in 2016 to ease some of that uncertainty or to create more economic certainty for our families, especially middle-class families. One of the most important steps we can take to address some of the challenges that our families face is to boost middle-class incomes. The most significant challenge we have as a nation right now, I believe, over the long term is what will happen to incomes, especially what will happen to middle-class incomes over time. I have an amendment today that will address part of the solution or part of the strategy to raising incomes. One of those ideas is an expansion of the Child and Dependent Care Tax Credit. This is a tax credit which helps families afford childcare. And so I'll talk about that for a couple of moments today, and then the other issue we're going to deal with is a so-called dual earner tax credit, which helps families who have young children and where both parents work outside the home. I don't think it's a news bulletin to anyone here or across the country that the cost of childcare has skyrocketed, especially in recent years. A recent study by the Pew Foundation found that average weekly child care expenses rose 70% between 1985 and 2013. So the cost every week that a family is paying for child care is up basically 70% in 30 years, or 25 to 30 years. That's one of the many costs that have gone up in the lives of middle-class families. So their child care costs have gone way up. The cost of higher education has gone way up in that time period. The cost of health care, the cost of energy, the cost of food. It seems like for a middle-class family, every cost or every number you would hope would be going down or leveling off is going up. So as a result, child care is increasingly becoming literally unaffordable for middle-class families. That's a reality in a context where we know that the cost is going up at a time when all the evidence shows that quality child care can have a substantially positive impact on a child's life. One of the reasons why quality child care matters so much to a child is because they have opportunities to learn. And one thing I've said over and over again is that if our children learn more now, meaning when they're in those early years, when they're in child care settings, they're going to earn more later. That direct linkage, which all the evidence shows, all the data shows, all the studies show, the linkage between learning and earning is substantial. One of the best ways to make sure that kids learn more now and earn more later when they're in the workforce is to make sure that they have quality child care. Just to give you one example, in Pennsylvania, the average cost for full-time daycare for an infant is $10,640 for an infant. For a 4-year-old, it's $8,072. Those numbers sound almost like approaching college tuition, maybe at some public universities. Double-figure $1,000 numbers for childcare is almost hard to comprehend. $10,640 for an infant, $8,072 for a 4-year-old. So what does that mean for example, married couples in Pennsylvania? That means about 12% of their annual income is dedicated to childcare. How about for a single-parent family? A single mother, those numbers translate into 44% of her income. 44%. of that single mom's income going to childcare. And she has to have it because she has to work. So this isn't something extra, something nice to do. She's got to have that childcare. She's got to be able to pay for it. And if in a state like Pennsylvania, which is fairly typical, I think, of the country when it comes to these costs, if that single mother is having to pay 44% of her income on childcare, that makes it very hard for her to make ends meet, if not impossible. So this is why the tax code has long recognized the need to provide families with tax relief to offset child care expenses through the Child Independent Care Tax Credit. However, the way this tax credit is currently structured means that few families can benefit from it. Here's what we should do. We should make the full credit, I should say, available to most working families. More than 85% of taxpayers in Pennsylvania, for example, with children would receive the full benefit if our amendment passes. Increasing the maximum amount of the credit for children under 5 from $1,500 to $3,000, thereby reducing the cost of child care by 35%. That would be one of the positive benefits of passing the amendment. Third, ensuring that lower-income families are better able to benefit from the credit by making it fully refundable. We have not done that. We should do that. That's what families would benefit from. And finally, retaining the value over time by indexing the benefits and income thresholds to inflation. So that's what we do on the Child Independent Care Tax Credit, a substantially positive advancement for families trying to pay for child care as the cost of everything in their life is going up, middle-class families especially. Second, the so-called dual earner tax credit. We want to expand those tax credits for working parents of young children. The amendment includes a provision which would provide up to a $700 tax credit on any secondary earner's income for parents with children under the age of 12. We know that as our workforce changes, we must develop policy to ensure that our tax code rewards work and expands opportunity for working families, middle-class families. That should be the goal of everyone here. And I think on a lot of days it is, but sometimes the Senate doesn't focus on those priorities. Make the tax code reward work and expand opportunity. If we enact these policies, we'll guarantee that these middle-class families see their incomes go up, and we can do it in a fiscally responsible way that pays for these tax cuts by closing the most egregious tax loopholes. The amendment will say that companies can no longer evade U.S. taxes through so-called corporate inversions, which is when a large company buys another company overseas and then claims their headquarters are abroad. The inversions strategy that some companies have employed has been an abuse of the tax code and, frankly, an insult to working Americans. We also ask, as a way to pay for these changes, that the very wealthy who have received lots of relief over the last decade, the kind of tax relief we have not seen, in my judgment, in human history, not just U.S. history. So those folks at the very, very top have gotten a really good deal for the last decade or last couple of decades, but especially the last decade or so. And I think a lot of those folks would like to help their country and would like to help us pay for these common sense tax relief provisions for middle-class families, especially as it relates to paying for the cost of child care. So how do we do that? Well, we could enact as part of one of the pay-fors the so-called Buffett rule, named after Warren Buffett, pretty wealthy guy. But he's supported a measure that would ensure that a secretary or a teacher doesn't have a higher tax rate than someone making millions of dollars a year or literally billions a year. Finally, we'd ensure that those who run very large corporations aren't able to use loopholes to avoid paying taxes. So these basic common sense steps would make sure our tax code works for the middle class and not just those at the very top. And in particular, the way that the Senate can focus on middle-class incomes is to put in place policies that help families pay for some of their biggest expenses like childcare. Finally, Madam President, I'll move to the issue of Medicaid, which I know Senator Brown, my colleague, is here on the floor, and he's worked so hard on this issue over many years. I wanted to talk about a matter that we're working together on, and I appreciate his leadership on Medicaid. This effort we're undertaking would bolster the work that's been done over the last 5 years to expand access to Medicaid. When Medicaid was expanded on the Affordable Care Act, the so-called Federal Medical Assistance Percentage, FMAP by the acronym, this FMAP policy basically is what the federal government contributes to help states cover the cost of Medicaid. That was set at 100% for 2016. Beginning in 2017, the federal government's contribution would decrease until it gets to 90% in 2020. The amendment that Senator Brown and I and others will put forth will keep the federal contribution at 100% until 2020, instead of letting it drop to 90% by 2020. Pennsylvania has expanded the Medicaid program. We're happy about that. But doing that, what Pennsylvania did ensured that all individuals up to 133% of poverty are covered. Other states have not done this. This has created a so-called coverage gap that's impacting over 3 million people around the country. One of the reasons states point to in refusing to expand Medicaid is they cannot afford to pay the costs that they will incur beginning in 2017. Meaning when the federal share goes from 100 to 90, the states have to pay more, and some are using that or citing that as the reason they won't expand Medicaid. This amendment would remove that concern that's been asserted by governors and others around the country. States would be free to expand Medicaid without having to worry about how they pay the bills. So let's, and I'll wrap up with this, let's remember what Medicaid means. Medicaid isn't some far-off program that doesn't affect a lot of Americans. It affects directly tens of millions of Americans and tens of millions more indirectly. Medicaid, for example, pays for almost half of all the births in the country. So half of all the babies born in the country are paid for by Medicaid. Every senator in both parties should remember that. So this isn't some program that you don't have to worry about, that you can cut and slash without consequence. Half of all the babies born in the country paid for by Medicaid. How about older citizens? 60% of all skilled nursing home payments, that's a shorthand way of saying nursing homes, 60% of those payments are covered by Medicaid. 65% of the almost 23 million publicly paid resident days of care in a state like Pennsylvania are paid for by Medicaid, compared to 13% by Medicare. So Medicaid has a huge impact on long-term care for families across the country. And by the way, not just for low-income families. A lot of middle-income families benefit directly from the payments made by Medicaid for long-term care. So if you care about older citizens in your own family and getting a nursing home placement, if you care about 45% of all the babies born in the country, you better care about Medicaid. And you better care about efforts in a sensible way to expand Medicaid across the country, which would be better for all of us, especially the children who are affected, older citizens affected, and of course, Americans who have a disability are affected by Medicaid as well. So, Madam President, I would yield the floor.